Mr. Chen Chunying, Madam Deputy, according to the definition of WHO, now if the population, those over 65% of them, over 20% of the population is over 65, so then it's a super old society. As last year, 1.4 million of our population are elderly persons, accounting for 19% of our population. Now, we have a lower fertility rate and we have a higher aging population. So very soon Hong Kong will become a super aged society. Thanks to Mr. Chan Kim-Paul, we have this motion on promoting healthcare policy to let the elderly enjoy a quality life. I support the motion. Recently, the government announced that the threshold for the $2 traffic fare subsidy scheme, concession scheme, will be lowered to 60 years old. Transport fares in Hong Kong are very high, and as a result, many elderly persons will choose to stay home. This concessionary fare scheme will encourage elderly persons to move around in the community more. According to there is this book on longevity among elderly persons and social relations. Social circle ranked #1 when it comes to promoting longevity. So this $2 transport fare concession scheme will encourage our elders to move around. With more elderly persons in the population, we have to pay more in health care. In 2020, 22.8% of our budget is spent in this area. Now, compared with 2012 and 13, there has been 11.4% increase year on year. Last year, we spent over $39 billion in elderly health care. This indefinite increase will cause a heavy burden on our younger generation, so the government should change its mode in the distribution of resources. Elderly persons should be encouraged to do more exercise so that they can be fitter. Take walking as an example, where walking can lower blood pressure and help people to relax and lower the risk of cardiac diseases. To encourage our elders to do more exercise, well, the government can link up with e-payment tools. Now, if an elder walks for about 20 minutes a day, then perhaps $20 can be credited to his account, and there should be some network so that in all LCD venues, elders can be encouraged to do exercise together. And we should also encourage our elders to return to school. We have this elderly learning scheme for elders started in the 1980s. Now, the Elder Academy has expanded to post-secondary institutions recently that can be expanded to universities, because our elders can then spend the time on getting new knowledge and skills and to catch up with times. I'm sure this will be conducive to their general well-being, and they should develop healthy eating habits to reduce the risk of common diseases. Then they can enjoy their retirement happily. In all advanced economies, they all face the problem of an aging population. In places like Japan and Korea, they have a lot of TV programs about health care of or the well-being of the elders. And we can do similar things so that we can stress the importance of healthy eating habits for our elders. Elders will form the majority of our population. The government should plan ahead so that this group of our community who have contributed their whole lives to society should enjoy a quality retirement.